there any other methods of inducing melatonin naturally in our body? Music and sleep. So we might be feeling very comfortable in our lectures of inducing sleep in them.
It's a very beautiful question, actually. The score, so you can do scoring for yourself and find out.
When we change our place of sleep, we have a disturbed sleep for 1 or 2 days. Anything related to sleep hygiene? Namaste. I Akshat Verma, your host for today, welcoming you all on the very first inaugural episode of our podcast Beyond the Books, a podcast series that brings you stories from insights of medical world and beyond the boundaries of your textbooks. Today I am truly honored to have with me a woman of vision and purpose, Professor Dr. Monika Pokharel ma'am, Senior Consultant ENT and Head and Neck Surgery. She is also a sleep specialist here at Dhulikhel Hospital, Kathmandu University School of Medical Sciences, and also a pioneering researcher with 31 publications in national and international journals. Welcome, ma'am. Glad to have you on board.
Thank you so much for having me here. I'm very excited to be a part of this podcast.
So let's start from the beginning, ma'am. Tell me something about your journey as an ENT and head and neck surgeon. Was it always a plan?
Yes, it was definitely a plan because I was very much interested in developing the subspecialties of ENT in Nepal. Also, I wanted ENT because it has a blend of medicine and surgery, and there are very less number of doctors as ENTs in Nepal, so that fascinated me towards ENT.
You have specialized in it. Also, you are teaching, doing multiple researches and stuffs. So, how can you explain this to students of our age and of this field, the extent of ENT, how, and put some light on the spectrum of ENT, how broad ENT is?
Yeah, definitely. ENT is a very broad subject, and I feel that ENT in the Asian countries is still in its infancy. We need so much to expand, and there are many fields in ENT which are very attractive, like otoplasty, rhinoplasty. We have skull-base surgery. We also have robotics in ENT. And there are so many things like silentoscopy, which we need to focus on. We are just focusing on few things. So I think there is so much to do.
Yeah, that sounds a blend of variety and depth.
Yes.
So can you just mention some of the milestones which actually shaped your career and shaped you as a senior consultant, as a ENT surgeon, HNS surgeon?
Mm-hmm.
So can you just mark and point some of those important milestones?
Yeah, the scope of ENT is very vast, and I should say that there's so much to be done in ENT. There are fields like otoplasty, rhinoplasty, skull-base surgery, silentoscopy, cochlear implantation, sleep medicine, telemedicine in ENT, robotics in ENT. There's so much vast. So it's not just epistaxis or nasal polyp or what you've been studying in your undergraduate books. There's so much things are to be done.
So ma'am, as we have mentioned, ENT sounds like a perfect blend of medicine as well as surgery with variety as well as depth in it. Yeah. So can you pour some light on your personal milestones, your personal journey as a medical student, now to as a senior consultant, as our role model, as we are seeing you, we are actually very impressed by your journey, and we actually want to know what is your, what has been your journey from as a medical student to where you are standing right now.
Thank you so much. Actually, my journey started as a medical student in Mymensingh Medical College, and during that time, I was more interested in internal medicine. But as I started working as a medical officer in Dhulikhel Hospital, I realized that ENT has a blend of medicine and surgery in it, and there are so many subspecialties in ENT that I was more interested in developing in my country. So the zeal to develop the super specialties, that drove me towards ENT, actually speaking.
So ma'am, tell me about your experience as a medical officer to how you started joining ENT when you were a resident. So can you tell me some experience from your first surgery?
Yeah, so when I returned from Mangalore after doing my post-graduation from Kasturba Medical College, Mangalore, I was very focused in developing the field of ENT in my country because I felt that it was in its infancy mode. And I started with tonsillectomy, septoplasties, functional endoscopic sinus surgery, which was that time itself, it was a big thing. And slowly we moved on to thyroid surgeries, and now we are happy that we are doing almost everything in ENT. And we hope that we still continue to develop our field in Dhulikhel Hospital, also in the field of sleep medicine, in cochlear implantation, and hopefully hypoglossal nerve stimulation and so on. Let's see.
So as you have mentioned that you started with tonsillectomy at very
Yeah.
first. So were you nervous when you were stepping into the first OT of your life as a consultant or as a senior, the main person in the operation room? So were you nervous that time?
I was not nervous, frankly speaking, because I was very confident that time, because we were trained very nicely by our teachers, and so many thanks to my teachers in India that they trained me in a very beautiful way. So as I stepped into the ENT operation theatre, I was fully geared up and I was very confident.
That sounds incredible, ma'am, and that's what we need to learn from you.
Thank you, Akshat.
And ma'am, coming towards any specific challenges or any specific kind of knowledge gap that you felt is evident here in ENT.
Yeah, definitely. I felt a lot of knowledge gap, and I felt a need to develop the field. So for that, I went for my observership, clinical observership to Kaiserslautern, Germany. And actually, it was a general otolaryngology observership. But as I went there, I saw that they're doing very good image guided surgeries for the functional, as an adjunct to the functional endoscopic sinus surgery. And also, they had a very good sleep lab. So I felt that our people needed more of the sleep lab, because the obstructive sleep apnea population in our country is like a tip of an iceberg. So I requested my mentor, Professor Dr. Norbert Stasche, to train me specially on sleep medicine, and that's how I started sleep medicine in Dhulikhel Hospital after returning back from Germany.
So this entire thing was of which year? This the timeline. I just want to know the timeline which you're talking about.
That time I was, I guess, assistant professor. So
Okay.
I was there for 1.5 months,
Okay.
and then as I returned here, I had to struggle because there was no OPD proper sleep setup. So I requested the hospital to provide me the specialized rooms for the sleep lab, and I trained my personnel here, the OPD technician. I did my own duties, the night duties for the starting the sleep lab, and I trained him on how to fit the how to do the hookup for the polysomnography. And slowly we started our polysomnography service in Dhulikhel Hospital. And
Wow.
after a few months, we again sent our technician for training in Kaiserslautern, Germany, for his sleep technician training. And after that, I felt that there is a lack, because we just treating patients with CPAP, and it was not a total treatment for the sleep apnea patient. So I started looking into surgery field, and I felt that we should start the sleep surgery field in Dhulikhel Hospital. For that, I took help from my Indian friends. So I'm very thankful to them that they guided me in starting the sleep surgeries. And after that, also we did the drug-induced sleep endoscopy, because it is very important in order to decide the site-specific surgeries for the patient. And now my focus is also on researches related to sleep, and also the positional devices, which can be very helpful to the sleep apnea patients. So I'm working on developing a sleep positional device. For that, I'm planning to take help from the Avishkar Kendra. Let's see how it goes.
Wish you all the best for that, ma'am.
Thank
And
you.
regarding the timeline, what you said, this is of what year? We are talking about 2017, 18.
It was, I guess, around 8 years back.
8 years back.
Yeah.
And 8 years back, you thought of developing a sleep lab here in Dhulikhel Hospital. And what is the current scenario? Do we have a sleep lab here in Dhulikhel Hospital?
Of course, we have a very well equipped sleep lab, 48 channel polysomnography machine. Also, we have a trained sleep technician who can very nicely do your level 1 monitoring as well as the portable monitoring. That's the level 3 monitoring for those people who cannot come and attend Dhulikhel Hospital. Also, we have started our drug-induced sleep endoscopy with the help of our Indian colleagues and also our anesthesia doctors in Dhulikhel Hospital, and we have also started the sleep surgery. So also along with that, we have a multidisciplinary team of people here in Dhulikhel Hospital as well as in Kathmandu, and we also started a sleep society. So we are working as a team, and we are working towards perfection, and also we are doing some awareness programs in ENT. We are educating the medical professionals, and very soon we are going to have a sleep conference, all Nepal sleep conference, which will focus on all the aspects of sleep medicine.
So that's a groundbreaking achievement of developing a sleep lab here in Dhulikhel Hospital. That too, having a vision and having a drive for developing a sleep lab here in Nepal. And we really are very proud of you, ma'am, for this.
Thank you.
And ma'am, just you have mentioned 3-4 points. I will just want to know more about that, because as a medical student, we just focus when it comes to sleep. Starting it from our basic educations to our clinical education, we just hear a term known as sleep apnea, and that is the only thing what we think is relevant for our examinations, as well as I think the patients might be coming. We study it in medicine as well, surgery as well. The only common term which appears is sleep apnea. So, is there any other thing, any very other common presentation related to sleep disorders, or anything way which you can say that this is sleep apnea, this might not be sleep apnea, or anything like that?
Yeah, so when a patient comes to you with a sleeping disorder, you have to keep in mind that it cannot just be obstructive sleep apnea, and that it can be associated with many other sleep-related breathing disorders. The first thing you have to do is you have to differentiate whether it is a obstructive sleep apnea as such, or it is another sleep disorder. So, if it is a obstructive sleep apnea, you have to first ask the patient symptoms like snoring, excessive daytime sleepiness, the fatigability, the irritability, the dryness of mouth, fatigue, the road traffic accidents, inability to concentrate, frequent micturations, and the association with the metabolic syndromes. That is a very, very common presentation that we are seeing in our patients. And usually the history needs to be taken in presence of the spouse or a person who sleeps with the patient. Suppose it is a pediatric patient, so you need to take the history from the parents, and once you come to know that the patient, if you suspect that the patient is having obstructive sleep apnea, there are a variety of questionnaires like Epworth Sleepiness Score and the Stop Band questionnaires and so on. And you fill a questionnaire and you do the drug-induced sleep endoscopy, and then after that you do a complete ENT examination. You see whether there is a retrognathia, whether there is a hypoplastic mandible, or is there any tonsil related enlargement, tonsillar enlargement, adenoid enlargement, or any laryngeal masses, or any other things that are related with the obstructive sleep apnea, and you take the patient for the polysomnography. So that is when you differentiate whether patient is actually suffering from obstructive sleep apnea or not, by the help of the polysomnography machine. And you categorize the OSA, and suppose sometimes you may be suspecting obstructive sleep apnea, but the patient may be suffering from a narcolepsy or a sleep bruxism, or sometimes patient may just be having a primary snoring, or patient may be having a simple snoring. So such kind of patients, you have to tailor the treatment for the patient. It's not that everything fits for everyone. So you can't think that you can give CPAP to a patient and it will or you can do sleep surgery for the patient and it works for everybody. No, sometimes you need to have a dentist evaluation, prosthodontic evaluation or a orthodontic evaluation, or you may, if suppose a patient is very bulky, if a patient is obese, you need a bariatric surgeon for your treatment. Also, nutritional evaluation is a must. So there are so many things that you have to keep in your mind, and I like to focus that it is a more multidisciplinary thing that is to be done.
That sounds really great, ma'am.
So I would like to add on that sometimes the patient may not be able to self-diagnose because the patient is unaware.
Exactly.
Patient is unaware. So you need to have a spouse or your parents or somebody who sees the patient, that the patient has stopped breathing, there is a cessation of breathing and patient is having choking, and there is a total pause, and then again the patient gets back to sleep. Sometimes patient will just come with polyuria. So you can't say that the patient can self-diagnose.
Yeah, that will drive the patient's own history towards more of diabetes and stress rather than developing a sleep disorder.
Yes.
We are actually getting some insights about what ENT and sleep medicine is, and that is the whole reason behind starting this podcast, Beyond the Books. As you were stating about the symptoms of developing sleep apnea, sleep disorders, one question just spiked into my mind. We often sleep in our classrooms, in our lecture rooms.
Yeah, I have seen that. By the way, yeah, the reason being the change in the circadian physiology and because of the lack of sleep hygiene, because maybe some people these days, they are so much addicted to their mobile phones, and it changes their hormonal status, and the intake of alcohol and lack of sleep. So the person becomes very much tired in the class. So there's where the role of effort sleepiness score comes. So you can do scoring for yourself and find out. So.
And ma'am, can you mentioned a term sleep hygiene. Can you just elaborate this term sleep hygiene? Because sleep hygiene even as a medical student, it sounds more like clean pillow, clean bed sheet. Is it something like that?
No, it's actually sleep hygiene is so much necessary for students because students need a very good sleep of 7 hours. At least 6 to 7 hours of sleep is so important for humans, because until and unless you get a good sleep, you won't have a good REM stage of sleep, which is very important for memory consolidation, for learning new things, and and you must have seen that a REM stage of sleep is so much more in case of children. That's why they are more they are more able to acquire new skills. So if you want to be a good student, you must have a very good
sleep,
good sound sleep, and stop your mobile phones and sleep in time. Make a regular habit of sleeping in time and stop using the blue lights.
Okay, so how this mobile phone and blue light thing is actually contributing and disturbing our sleep?
It directly affects your hormonal status.
Okay.
The change in the melatonin hormone levels in the body, so that disturbs your sleep. And also it disturbs your circadian physiology.
So is there any other methods of inducing melatonin naturally in our body?
Of course, you have a tablet available.
Oh, we have to depend upon the supplements then.
So if you don't want to take the tablet, you must make a regular routine of sleeping, and you should stop your mobile phones. You should eat healthy, exercise healthy, stop alcohol. So these are the things how you can, start a healthy sleep lifestyle.
And that's very deep information, because till now I was also not very aware, because often I used to scroll reels and watch Instagram, Facebook while I was lying on my bed seeing, and I was staying awake till 2 or 3 a.m. in the morning, and now I'm cracking it, ma'am. Thank you so much for that. Yeah. And one more question which came into my mind. When we change our place of sleep, sometimes we are sleeping in our own bedroom, sometimes we are traveling somewhere, whether it is a hotel or somewhere other, we have a disturbed sleep for 1 or 2 days. Anything related to sleep hygiene or any stuff?
No, actually it basically depends upon your habits of sleep. It's nothing related to a circadian physiology. It's like more of a comfort thing.
So when you're comfortable, you feel
Yeah, you feel
asleep.
sleepy. Yeah.
So we might be feeling very
So that
comfortable.
is also a part of sleep hygiene. You try to spend more on very comfortable pillows, comfortable blankets. That is important part of sleep. And try to find some nice sleep music. It's very important. By the way, there is a new sleep music developed by the American Academy of Sleep Medicine, and they have introduced it this time in the conference. So you can use that, and there are many, available in the internet also, in the YouTube. You can listen to such peaceful music and make it a habit to make peace your priority.
So in short speaking, comfort, music, and sleep.
Yes.
So we might be feeling very comfortable in our lectures.
Yeah. That is actually true. They have introduced a sleep music. It's very interesting, no? They introduced in the conference this time. That I am planning to play here in our conference also as a background music.
So sleep music.
Nobody sleeps.
I'll be there to record that if everyone sleeps, and how evident that sleep music is, ma'am.
Yeah.
And there's also a term called sleep pillow in the market.
Yeah.
So is it very practical, or is it very useful, the sleep pillow?
Yeah, definitely for the people who are having cervical problems, and who are more addicted to a very soft pillow, or the memory pillow. It takes the shape of the head. So yeah, definitely it is helpful, I guess. Yeah.
So for having a perfect sleep,
Yeah.
coming towards how a normal person can perceive sleep, do we need is it upon our own convenience, choosing a hard pillow or a soft pillow, choosing a hard mattress or a soft mattress? Anything specific what a doctor or sleep specialist suggests that we should consider using these kind of pillows, these kind of mattresses?
No, actually, there's nothing as such. As long as you are comfortable with your pillow, go for it. There's no hard and fast rule on that.
This statement is going to break a lot of market, because a lot of people are selling their products saying you'll sleep better when you have a soft pillow, when you have a soft mattress.
But some people are used to hard pillows. What about that?
That's what. So for all those market guys, this is a breakthrough to you.
I'm sorry for that.
I was just curious, ma'am. I have heard in the international media as well, the army personnel practice a specific method of inducing sleep in them. So is there any specific practice what we can do, or what these army personnel do to induce sleep?
That's a very beautiful question, Akshat. Actually, in history of sleep medicine, as you read the history of sleep medicine, it's written that in the past, the army people were asked to put the bags on and then sleep. So that the bag lies at their back, and then they are in a specific lateral position. So there comes the role of positional therapy.
Okay.
So as they acquire the left lateral position or the right lateral position, for the people who are obese and who are having the positional kind of apnea, it really helps. And also we can do some breathing exercises, the myofunctional oropharyngeal exercises, the exercises of the oropharynx that will lead to, that will prevent the airway from collapse. So it helps to some extent, along with the weight management. That's a very, very important step of management in OSA, that the people who are having, who are overweight, they need to lose 20% of their weights. And also you should be aware of the fact that some very thin weighted people can also have obstructive sleep apnea, and they can have a REM behavior disorder. So in that, the person will be very thin built, and still they are suffering from obstructive sleep apnea. So in those conditions, you should identify it by the use of polysomnography, and you must go for treatment. And because it's more risky, and it carries a cardiovascular risk.
Okay, in this entire conversation, you mentioned the term as breathing exercise.
Yes.
So using our phone as well, we get different applications which train you for breathing. 30 seconds of breathing in, 30 seconds of breathing out, training your breathing. So is this related to inducing sleep, or something more of a respiratory problem, treating that?
Yeah, I think, I guess the thing you're talking about, it's more about a respiratory thing. But we have a oropharyngeal myofunctional exercises. It is a variety of exercise It's easily available in the internet, so you can go through it and then you can practice it and use it as an adjunct for the treatment for obstructive sleep apnea patients who have various varieties of obstructive sleep apnea. But you can't use it alone as a treatment. Not just the weight management and the positional therapy or the oropharyngeal functional exercises. These are an adjunct to the treatment. And suppose you have a person who has retrognathia, so you need to take that patient for the orthognathic treatment.
So
For the
dental
you need
consultation.
a dental, yes.
Okay.
You need a dental, or suppose there is an overlap syndrome, you need a pulmonologist. Okay, because most of the sleep apnea patients these days, they are seen by the pulmonologist. So it's good to have a pulmonology review. There's no doubt about it.
So
it has to be interdisciplinary.
So the multidisciplinary
Yes.
point which you mentioned was point of including a ENT surgeon,
Yeah.
point of including a pulmonologist, and as well as a dental
Dental, bariatric surgeon, nutritionist, cardiologist, psychiatrist sometimes, psychiatrist. So that's what the conference is also about, the upcoming conference. We are focusing on this matter as well.
So to offer a more holistic approach
Yes.
towards treating sleep disorders.
Yeah.
I'm actually getting a lot of insights as well as busting a lot of myths with these facts what you are saying. Thank you so
Yeah.
much, ma'am.
Thank you very much.
We are busting all those myths. One other myth also popped in my mind
Yeah.
regarding sleepwalking, committing crimes in dream, and having explicit or aggressive dreams.
Yes.
So, what is your take on that?
That's a very important thing you're talking about. It's all about REM behavior disorders. So that's diagnosed with the help of polysomnography, and
Okay.
there are many crimes happening, or sometimes the person opens the door and he's walking somewhere. There are some accidents occurring during the sleep. Sometimes even the person is driving.
Yeah.
Okay, so many things you must have heard in the story in the news.
Yeah.
So these kind of disorders, and sometimes there are periodic limb movement disorders. There are so many things which need to be identified during the polysomnography, and you can treat it. So also there comes the role of a neurologist here.
Okay.
Neurologist. So suppose there is a central sleep apnea or a mixed apnea, so it has to be a multidisciplinary thing.
Okay.
Yeah.
So, like when these facts are actually true, committing a crime in sleep.
Yeah.
So, is there talking about the forensic approach of this?
Of course,
So, this is
of course. So this time we also have a forensic talk in our conference.
Exactly.
Yeah, it's a very important thing. The forensic expert needs to be involved sometimes. Yeah, that's true.
So, this conference, which will be talking in a while, will be helpful for everyone, whether he is an ENT surgeon
Yeah.
or anything who will be dealing with this
Yes.
sleep disorders and sleep problems. Let's move on to the next segment of our discussion, the upcoming conference. As we all know, Dr. Monika is organizing an international conference focused on sleep apnea. Let's hear from her what this conference is up to and what can we expect from this.
The conference will be an academic feast which will be featuring the panel discussions, the state-of-art lectures on advancements on sleep medicine, and it will also be focused on the hands-on polysomnography training and also the PG poster session. So it's very beneficial for the postgraduate students as well, and I welcome everybody to attend this conference, and we have very eminent speakers from the international speakers like Professor Norbert Stasche, who is a very renowned otolaryngologist. Along with him, he is from Germany, and we have three very renowned Indian otolaryngologists, Professor Dr. Vanilla Devarakonda and Dr. Sampurna Ghosh, Professor Dr. Dinesh Valse. We have also our very own, my friend, Professor Dr. Kazi Atik from Bangladesh, and we have Dr. Saraiza Abu Bakar from Malaysia. We have our very own very renowned sleep specialist who is regularly attending the American Academy of Sleep Medicine conferences, Mr. Glenn S.A. Roldan, and we have Magdalene Silencino, who is also a polysomnography technologist who is regularly attending the American Academy of Sleep Medicine conferences. Along with that, we have very renowned national speakers who are working in the corporate setup and in Kathmandu and also in our hospital. Senior consultant Dr. Raju Upangeni, who is a pulmonologist and intensivist from HAMS Hospital, and ENT surgeons, Professor Dr. Bibhu Pradhan from TUTH, Professor Dr. Inku Shrestha, who is a senior consultant otolaryngologist, myself, and Professor Dr. Pankaj Pant, who is a pulmonologist from TU Teaching Hospital, Associate Professor Dr. Prajwal Pant Shrestha from Grandi International Hospital and Beer Hospital, also Associate Professor Dr. Yogesh Nupane, who is a very renowned sleep surgeon working in the TU Teaching Hospital. Along with that, we have our very renowned Professor Dr. Sanjay Humagai, who is a cardiologist working in our hospital. We have Dr. Dashrath Kafle. Professor Dr. Dashrath is working in, he's a senior consultant orthodontic surgeon working in the Thulikhel Hospital. Along with that, we have Professor Dr. Rajkumar Karki. He's a senior consultant forensic expert who is working in the in Thulikhel Hospital. So I welcome you all to attend this very prestigious mega event being held in our hospital. It is definitely going to be a very good event. So thank you very much.
This will be a great opportunity for all those budding ENT surgeon, intensivists, pulmonologists, forensic experts, dentists, sleep technicians, and other allied medical professionals. The more details about this entire conference will be left somewhere in the description box below, and the contact number of designated person is displayed here on the screen. Also, I would like to thank you, ma'am, for letting us know about this conference. Wish you all the best, and I expect that this video reaches the right audience and they can contact you and the team for participating into this sleep conference.
Thank you so much for having me here.
Ma'am, what are the advices you would like to give us, the students?
I would like to request all the undergraduate medical students to work hard and always to believe in yourself and sleep tight. Also to reduce the uses of mobile phones, and also to opt for ENT, since it is a very budding field. It is a beautiful field. There is so much to do in it. There are many subspecialties, beautiful subspecialties where you can pioneer. So please opt for ENT.
Thank you so much, ma'am. Thank you so much for your beautiful words. Thank you so much for joining us here. Really grateful, ma'am, for being the guiding voice in our very first step beyond the books. And to our listeners, I want to say, stay curious, ask deeper questions, and always remember, there's more to discover beyond the books.